Welcome everybody to our webinar this afternoon, talking about wellbeing strategy. Hope you're all having a good day so far today. We will be having a look at some slides to show you, which will be shared shortly. Here they are, coming along now. And we also actually have two presenters. We'll be introducing ourselves in a moment. And we also have Dimple from IOSH, who's helping us very well in the background, which is marvellous, just exactly what we want. We definitely need some help. So a little bit about me is, so I'm Amanda Livingstone. I'm the chair of the education group, one of the groups that we have within IOSH. I've worked in health and safety in total for 19 years, and I currently work at a university. So I've worked in HE for the last 7 years, and prior to that I worked in a college in the UK. This is both in the UK, and I worked there for 12 years. I've got quite a lot of experience of working in the education sector. My role associated with wellbeing, so I'm a health and safety manager, but I also have the strategic lead for staff wellbeing within my university.
Good afternoon, everybody. Welcome to this IOSH webinar. My name is Steve Smith, and I'm a member of the IOSH education group. I have worked in health and safety for just over 30 years now. The last 21 of which have been in work-based learning, working for a large training provider in the building engineering services sector. My input on the wellbeing within the business is I lead on the wellbeing policy and strategy across the business.
So to talk about a wellbeing strategy, we need to think about things like what is wellbeing. So this is one of the definitions of wellbeing. It's the one that, and there are a number of them. This is the one that I prefer. So it's a holistic concept. So this idea of being a whole person idea, but it also includes the person, the individual, psychological factors, any social factors, and what's going on within the environment, which might affect our well-being, which leads to the prevalence of pleasant emotions over unpleasant ones, which gives us that feeling of good well-being. By the way, if you have any questions, I know it said in the introduction video, do please put them in the Q&A, and we'll have a look at those at the end. We'll be answering any questions that you have at the end. So mental health, because this is part of wellbeing, but we can, if we think of it very importantly, to make sure that we include mental health quite specifically. So mental health is something we all have. We all have mental health, and it's just the same as we all have physical health. It exists on a spectrum, and we can move up and down the spectrum from good to poor. Some people may have more struggles with managing their mental health than others, and maybe they'll spend more time in the spectrum down at the lower ends, and other people may be managing their mental health better. We looked at the slide which talked about well-being. It might be some of those other factors that are causing people to struggle more with their mental health, or having good mental health. Those things that we can do to manage our mental health and have good mental health. So it's something that we need to be considering, both these factors, when we're writing a well-being strategy.
Okay, before we move on to look at a wellbeing strategy, I'd like you to take part in a short quiz looking at some mental health facts and figures. So Dimple, could we launch the question 1, please? Okay, so how many people will experience a mental health problem in a year? Okay, thank you. I can see the answers coming in there. Thank you. If we can share results, please. Okay, thank you. Excellent. So basically, it is 1 in 4 is the right answer. However, there are many more people who will have times in their lives when they are perhaps struggling a little bit, but don't necessarily have a diagnosis or a sort of diagnosis, and indeed may not even need to have a diagnosis, but they would benefit from some kind of support with mental health. And it's also interesting to note there that it's actually the 1 in 6 who are people who are in work will experience a mental health problem in a year. So that's actually demonstrating that being in work has a positive effect on people's mental health, and it's actually good for us all. You know, work is good in general for mental health. So thank you. Could we launch question 2, please? What percentage of organisations report positive outcomes from their health and safety and wellbeing activities?
It's probably worth pointing out actually that this data is UK-based data. So where we found this information from, it's UK-based data, and there are references at the end for where we've got this data from.
Thank you. Interesting there. So the actual, it was 89% of organisations actually report a positive outcome from their health and wellbeing activities. Of the 11% who did not report any benefits from the health and wellbeing activities, 3% reported it was probably too early to tell whether there had been any positive results or not. 7% did report that their activity they felt had not been beneficial. And the remainder reported it was hard to tell, mainly because their activity was not measured or could not be evaluated. And this data comes from CIPD 2020 survey, which are the latest figures they have on those as part of their survey. Thank you. If we could launch question 3 or poll 3, please, Dimple. How many organisations reported some stress-related absence in their organisations over the last year? Okay, thank you. If we can again share results. Excellent, thank you. So actually 79% organisations reported some stress-related absence over the last year. However, it's important to note actually that this rises to 91% of organisations with more than 250 employees. And it's also important to note, I think, that this data set actually came from a year affected by COVID. So it's interesting to see the effect that COVID may have had on wellbeing and mental health. And again, this data has come from a CIPD 2021 survey. Thank you.
So when we're thinking about strategy, we're thinking about, well, what is strategy? What do we actually mean by that? And it's often referred to as the matching of resources and activities within an organisation to the environment in which it operates. So simply put, really, it's a type of plan which fits the organisation. And when we're thinking of what that means, we're thinking about, well, what resources are we talking about? What resources support the strategy? So this could be financial, it could be people resource, it could be to do with spaces. What activities are we talking about? Well, as we're talking about education, as this is the education webinar, for education purposes, it could be teaching, it could be to do with support services, it could be to do with research. Obviously, for other organisations, if you aren't within the education sector, you would need to think about what your activities are within that organisation. And the environment, again, for our education group, it's education and training. So this could be public or independent, but could also relate to the culture within the organisation. And again, you would think about what your environment is for your own organisation if you're not within the education field. So when we're thinking about strategy, what's really, really important, and sometimes this is missed when writing strategy, is you write an intended, deliberate strategy, and you think about this, and you write a document, and actually you think, well, this is good, and maybe you write in a 3-year strategy, but you've got to consider what emergent ideas are coming along. So what other things are actually happening? So does the current intended strategy produce a realized strategy which is relevant to those stakeholders that strategy affects? So what do we actually end up with? And so a strategy, in a way, needs to not be completely fixed. We need to make sure that we can allow for an emergent strategy. And when we first write the strategy, we can't write that in, because we don't know what that's going to be. If we're writing a 3-year strategy, there might be critical things that come up. A really nice example of this is COVID. So our organisations will all have had strategies that talked about all the different things that were important to the organisation, and then COVID came along, and of course it's made a significant difference to probably every area of employment. So this is why we need to make sure that we might want to think about an emergent strategy, so that when we look at our realised strategy, what's actually happened, it's still relevant to our stakeholders. When we think of our stakeholders, we need to think about who our stakeholders are, and we want to think about what sort of influence and how much interest do they have. So we'll think about our stakeholders. So it means, how much do we need to, for example, manage them closely? So somebody who's got high influence or high interest would need to be managed closely. Somebody who's maybe got quite a lot of interest, but they don't have an awful lot of influence, would need to be kept informed. Low interest, but might have high influence, would need to be kept satisfied. And there might be some people who have low interest and low influence, and we just need to monitor to make sure it's relevant to them. And I've got a worked example here for the education sector for, this would apply for schools, colleges, universities. And I suggested that we will want to manage closely our senior management teams, our board, whoever it is we might think of, whatever your acronym is that you use for your senior management team, and also our staff. So our staff should be, and even if they're not actually interested in the wellbeing written document strategy, they're very, it is for their interest, and they have a lot of influence over the wellbeing strategy, because this really affects them. To be clear, actually, is that this is thinking about this, you'll be thinking about when you're writing a strategy, it's much easier to write a strategy if you're, depending on the sector you're working in. So education as the example, we think about writing strategies as one for staff. So how do we manage staff wellbeing? And we'll have another strategy which talks about how do we manage student wellbeing, because they'll be very different. We'll manage that in quite different ways. So it might well be that we'd have 2 completely different strategies, and although we want to see areas where they complement one another, and make sure that there is interactions within there, we do need to consider that it's probably easier to have 2 separate strategies. So one of the interesting points I've put here, and again, this is just my interpretation, this is how you would decide yourself. So for example, I've put unions as having high interest, but I've put them under low influence. Now, I have a really good relationship with the unions in my organisation. I find that engaging with the unions is incredibly helpful. I think that they have lots of important ideas. They can give lots of feedback for things that are happening. They tell me things that I don't know necessarily is going on. So I think it should, so although they're in the low box, it's probably more of a medium influence, but they're not in the high, because they don't have so much influence that actually they would be able to change the strategy if I didn't think what they were talking about was relevant. So you still have control over that, and this is why the idea is of having those unions there, although I do think it's really important to make sure that we engage in that. So I've just seen something's just popped up saying still looking at the previous slide, can't see the 2 slides were very much the same. So this is stakeholder mapping completed example, should be what you can see. Steve, is that what you can see?
Yes, that's what I can see, Amanda. Yeah.
Okay, I'm going to move on to the next slide, Steve, and you talk about this. So I'll just keep the control and you can talk about this.
Okay. Hopefully you can all see that it's headed stakeholder mapping work-based learning example. And what I wanted to demonstrate here and show you here is that although, again, I'm working in the education centre, I'm now reflecting work-based learning and training provider interests. And whilst we can use the same platform and the mapping system, it varies and changes slightly for us. So, for instance, for us, for high, who need to manage closely, who have a high influence and high interest. We have an executive management team who we obviously need to have a high influence and high interest in that, and we have to manage that them closely. In terms of keeping people satisfied, there is a high influence from our learners and our employers in the work-based learning sector, but really they have lower influence on the actual strategy and the outcomes. If we look at, so we have the same for the low influence and low interest for monitoring. We again have placement providers, and they sit in that box exactly the same. And then if we look at the high interest and low influence, similar to what Amanda was saying, we have a board, and whilst the board actually may feel they have a high influence and may sit in the high category, actually on a day-to-day running of the business and the day-to-day implementation, I feel they sit probably more into the low category. But again, they can move around, they're not fixed, and these can change accordingly. But this is my interpretation for us as a work-based learning provider, working in education and dealing with apprenticeships with employers and learners. So again, it's not a fixed board, but it shows how it can be just tweaked to suit your individual organisation and strategy, and how it would work for another organisation.
Thanks, Steve. So when we're thinking about writing a wellbeing strategy, we want to think about, well, what challenges might we have? What sort of things do we really need to make sure that we're thinking about when we're writing our strategy? So what wellbeing issues do we think we've got within the organisation? And there are various ways in which you can check this. There are a variety of different wellbeing surveys. You can Google this, you can find information out about how do you check. You can talk to your HR department, etc. So there are ways. So what do you know about what wellbeing issues are actually current in the organisation? You need to think about what's the engagement going to be when you're thinking about writing the strategy. How can you get people to engage in the strategy? And sometimes this is quite important when you're writing a strategy. This can be true about anything really, any strategy that you're writing, is you need to make sure that the strategy it falls into that reasonably practicable field. So when you're writing a strategy, you need to make sure that people will be able to engage with it. And importantly, that you do have the senior management commitment, because if you write a strategy and you write a strategy that the senior management aren't happy with, it's never really going to go anywhere. And you also need to consider, are there any financial uncertainties and volatility? So again, if you had just started writing a wellbeing strategy in March 2020, when we started with COVID, certainly in the UK, I know other areas they were affected on different timescales, then that might be such a volatile environment to then be working in. And in fact, actually, wellbeing, certainly my organisation, the well-being of our staff and our students, it became so critical, so it became so much a bigger part of my health and safety role, is to help people to manage their well-being because of that volatility. And they're the sort of things that we want to be thinking about. So when we're thinking of the content of the strategy, this is the sort of thing that we would need to look at. So what are our key well-being drivers? So we'll talk to our personnel or HR department, and really important, if you have got some sort of strategy, your personnel, HR, people strategy, whatever it is that it's called, but the strategy that is associated with the management of people, they will have within there almost certainly some key wellbeing drivers. So what sort of things do we see in that strategy that we want to be pulling out to make sure that we can put it in our wellbeing strategy? We've also got Time to Change. So Time to Change is a campaign, and there are many organisations who have made wellbeing commitments under the time to change, and that's why I've included it in here. It's actually been retired now, this wellbeing commitment. You can, and if you, the time to change campaign is still there, they've still got lots and lots of resources on there, but your organisation may well have written wellbeing commitments based on the time to change. It's really important also to pick those up. And if you've done a staff survey, probably within the last 2 years, again, the current climate, obviously COVID has made such a significant difference. Maybe you've done some short pulse snap surveys, you can see those sort of things. So it's really important to collect that information to look at wellbeing outcomes, to see what wellbeing outcomes staff are really looking for. So you might find actually that the staff survey is suggesting that people are struggling with their wellbeing, and it'll be picked up on certain areas within the staff survey. And then you want to make sure that you're including ways within the strategy that would help to support that, to improve people's well-being. So where else could you look for information? So when you're thinking about the sort of things you want to focus on within your strategy. So the Stevenson Farmer review called Thriving at Work, it's a few years old now, but actually it's still being referred to in current documentation. It's such an important piece of work, so it's really great to go and have a look at that. IOSH have got some work in well information, and the CIPD do health and wellbeing at work survey. So you can see Steve referenced that when he was doing the quiz. 5 Ways to Wellbeing is a way that we can manage wellbeing. There's a suggestion about these 5 different ways if we can help to look after our wellbeing in these 5 different ways. And there's information about that both on the NHS in the UK web pages, but they're available to anybody, and in Mind as well. And what's really helpful too is have a look at other similar organisation strategies. So when I was writing the wellbeing strategy for my organisation, I had a look to see what the universities were doing. What did they say? Because if they've already done, especially if they've got a more mature wellbeing model than I had, then I can also talk to them about, well, how did that work? What did you find? How can I learn from other people? I'm very much keen on how can we share good practice? How can we make those connections? Talk to your other colleagues who have within the same area as you, who have those connections that you have with wellbeing. And this is just to give an example. So this is the sort of an example that you could give for a strategy. So one of the objectives might well be associated with supporting good mental health. So this is an objective within your strategy. And this objective might have been decided on because your staff survey are saying people actually are struggling a bit. You might also see this from staff sickness records too. So I'm going to talk about this as an example of a staff wellbeing strategy. So what can we do? How can we support good mental health? So by the way, this is just a real short example. It might well be that you'd have bigger actions in here. But so in actions in here, for example, you say about training for leaders and staff in managing and supporting those with mental health issues. And in fact, we found a really good, really difficult sometimes to find a proactive training provider. And you'll see when you see the references, I use an organisation, I'm a trainer for IACT, it's an IACT course, IACT for Positive Mental Health and Wellbeing. You see a reference to that at the back. That's what worked really well. The last slide's got the references, worked really, really well in my organisation. And if you do have a time to change pledge, then have a look at that, see what commitments might already have been made, and make sure that they are still relevant, or maybe you need to update the action plan. And then you might want to put some measures in. So these are quite simple measures that I've put in here just to give an example. We might want to think about providing healthy workplaces. We're looking at physical environment, on individual and collective well-being, because, you know, how does the environment affect the person who's sitting in that particular space or teaching in that particular classroom? But what about the collective effect on everybody who might well be sharing that space as well? Again, we're thinking about the reasonable practicability of our activities when we're doing things like this. Some more examples on here. So you can see that these are sort of key drivers in this first column: the recognition, communication, engagement. These are our key strategic points that we're looking at. And then more of our or how will we actually make sure that we have good engagement with wellbeing? How will we have good communication? So also your strategy doesn't want to be huge. You know, you want to make sure that you've got a number of quite broad, maybe key strategic points like I've got here, and then your actions under them might be much longer. But again, we've got to make sure it's reasonably practicable, and can we realize this? So also really important, being safe and well. We know health and safety is really important for people's well-being. I think well-being sits under the health and safety. So I think it's really important, and I like to make sure that it's defined quite well within the strategy to make sure it doesn't get missed or lost.
Okay, thank you. So before we move on and we start to look at the implementation of the strategy, what I'd like to do now is to invite you all to take part in a short wellbeing exercise, commonly known as the green, amber, yellow exercise. And in order to take part in this exercise, I'd like you to turn your cameras off if you have them on, and I will do the same, and I will just talk through the exercise with you. Okay, thank you. So what I'd like you to do now, if possible, I'd like you to stand, if you can, and just relax yourself as much as possible. And if you're not able to stand at the moment, that's not a problem, don't worry, just relax as much as possible. And what I'd like you to start to think about is think about a work activity that you actually really quite enjoy doing. It's an activity that you feel very confident about. You don't really need to think too much about the activity to complete it comfortably. And really at the end of this work activity, you feel quite relaxed and happy and pleased with the outcome. And what I'd like you to do is consider that scenario as what we'd call your green space. This is your really happy space, a really good well-being place to be. You're relaxed, comfortable, happy, and enjoying what you're doing. And my example of that for me is I really enjoy the training aspect of my role. I really enjoy delivering the IOSH Managing Safely course. I feel comfortable doing that. So I really enjoy the interaction with the delegates. I find that I learn just as much as the delegates do, if not more, every time I deliver a course. And I really enjoy that side of my role. And that for me is a really good place to be from a well-being perspective. And then what I'd like you to do, if possible, and if you can, is perhaps just take a step to one side, or just imagine that you're now moving into a different space, and thinking about a work activity that, even though you can do it well, and you feel fairly comfortable with that activity, sometimes you find it a little bit challenging, and you may find yourself maybe not so confident with perhaps how things will go, how things will work out, what the outcomes will be. We want to consider this as your amber space. Now, we all know that a challenge is good. It's good to have a challenge, and it's good to be challenged, and it can be really positive for mental health and well-being. And that's fine. And this is sort of your amber space. So my example of that in my work activity is I'm involved, as we said, in wellbeing strategies, and I'm also involved in return to work risk assessments, where perhaps a member of staff may have been off following a period of illness, or they may have undergone surgery or procedure, and they're returning to work, and I've been asked to look at and do a return to work risk assessment. Now, whilst I really do enjoy that side of the job, and I'm fairly confident in doing that and familiar with the role, I find it a little bit challenging because I never know what person or what I'm going to come up against, and how that individual will interpret what this risk assessment is about. They may be wary of why we're doing this risk assessment. They may not be comfortable with discussing maybe personal things that they may feel might not be kept in confidence, etc. So it's always a little bit of a challenge, because I'm not sure what person I'm going to be coming up against, or barriers I'm going to be coming up against. And whilst I quite enjoy that side of the work, it is at times a challenge, and that for me is my amber space. And then finally, if you can, or if possible, again, just take a step perhaps to the other side, if possible, or just imagine yourself moving again into a different scenario, a different area, and think about perhaps a work activity that maybe you find a little bit more challenging, and maybe you don't quite enjoy that so much, or you don't quite feel confident with this particular role or aspect of the job, and you find that rather challenging. And maybe you may even become a little anxious about completing that task, etc. And that we would call your yellow space. And we find yourselves in this yellow space. And my example for that, I mentioned our board earlier. Our board members quite often feel they have high influence, and they do. And they're,
Sorry, Steve, can I just say red space,
yes.
I think you mean here.
Oh, sorry, red space.
Yeah.
Two apologies. Yes, red space. Apologies. This is thank you, Amanda. This is your red space. So my example of that for me is perhaps working with the board, and when I'm attending board meetings, perhaps doing a presentation to the board, I don't feel quite so confident. I get a little bit more anxious and a bit nervous about how things will go, etc. And the idea here is to really try and move yourself from that red space and being anxious and concerned about the activity back into your amber space, or ideally, if you could, into your green space, by really trying to counterbalance those thoughts and your anxiety with more rational thinking. So the way I do that with the board members, for example, I actually have to remind myself that, well, actually, they're not here to catch me out. They're not here to trip me up, and they're not here to cause a problem. They're actually here to support my role and my work within the business. And all they're really looking for is perhaps statistics or information about a certain subject. And really that puts me back into, why am I worrying about this so much? Why am I panicking? And I can move back out of the red space into my yellow, and hopefully, ideally, into my amber green space. And that's a little well-being exercise that we can use to try and move ourselves from perhaps a difficult situation or something we find quite difficult back into a more comfortable spot. Okay, thank you very much. I hope you participated and found that useful. If you could turn your cameras back on now, that would be appreciated. Thank you.
Thanks so much, Steve. I really love that exercise. I think it's something that we can all think about doing, and thinking about how can we try and manage some of those feelings of anxiety that we get. And actually, it's something that you can do as part of team meetings that you have. It's a really nice, you can do it in quite a short space like this. Steve was doing good giving examples. It's not something, and you can either ask people to share their examples with you if you want to, or you might choose not to. You might prefer, people might prefer actually to keep their examples to themselves. So when we're thinking about how we are going to implement the strategy, we need to think about how can we get people to engage in wellbeing, because it's all well and good, we can have this strategy, we've written this strategy, how do we now get people to engage with the things that we want them to do? And the first most important thing really is to make sure that we provide strong leadership. And this is leadership in many different ways. So if you are the person who has a lead for wellbeing, then you need to make sure that you're the one who is being proactive about it. But can you also pick up people of influence who can provide a bit of leadership for you as well? Sometimes, I mean, maybe wellbeing champions from within your staffing group. Now, it might not necessarily be any sort of formal role. It might not be anything like that at all. It just might be people who you know who will be able to help you out, and they can provide these little pockets of leadership as well about wellbeing, the people who can really move things on. So it's really good to provide this strong leadership. You need to get your senior management team involved as well. And is there somebody within that SMT who can champion other members on your behalf? And this works really, really well because it gives you your giver into that senior management group if you're not already part of it, because that means then if you are thinking about how can your strategy interact with the organization's strategy, you have your champion on the SMT who, when they're talking about something and there's a connection, or well-being could be affected positively or negatively, then they can bring well-being onto the table as well. And then thinking about how can you raise the profile of wellbeing to make sure as many people as possible are engaged in it. Can you maybe think about running focus groups for ideas? And this might mean that you would create some web pages, including staff newsletter. You would know in your organisation where to find the best way to have this engagement. So the best way really then to do this is to think about how can I have an operational plan? I like to be quite an organized person, so this is what I have found works for me. So I've got my strategy, my wellbeing strategy, which I showed you an example earlier, but then I've said, for example, what did I say? What did I list of things that we need to do? So one of the things I was saying that we need to do, as one of our top strategic goals, is making sure that we have training for leaders in managing those with mental health issues. And I've thought, so what expertise or experience would be useful in respect of this strategic goal? So when we're thinking about how do we achieve this strategic goal, the person who achieves this needs to make sure they have an understanding of mental health and requirements for that training. So the person who's looking at managing this, dealing with this, organising this training, they need to make sure that they understand what it is really that they're looking for and who is that person. When you're doing something like this, it's really good to put named people in. So I've used myself as an example here. And who else? So we thought about our stakeholder. Who else might we need to be involved in this specific point? Who would we want to talk to? So when I was looking at this, I talked to my colleagues in our occupational health department, which are actually part of our safety team. And I also talked to our equality and diversity colleagues as well, to see what information they had. I talked to them about the training course that I found. I looked at a number of training courses. We discussed them. And it's good to have that. They almost became my mini focus group for looking at this. And then actually I took it out a bit wider and ran some focus groups to talk more widely about this. And that was me providing my leadership with that. So this is, I think, something that's really quite useful, is to write an operational plan like this. And this operational plan, the idea for this actually comes from one of the references. You'll see there's a books references, and it comes from within then. It's about writing strategy. Again, this could be done for any strategy. It's a way to be writing strategies, not just particularly wellbeing. But these are the examples about our top strategic goals. And then when we're thinking about targeting, so who do we want to talk to? How can we target? What do we really need to focus on? And I think there's three important things really to be thinking about. What's going to have the biggest impact? So is this something that we can do? Is it a wellbeing strategy that we can really focus on that's going to have a really big impact on the staff within the organisation? What's most needed? And actually also really important is what's the easiest to achieve? Because when you're thinking about doing this, if your wellbeing strategy has things in there which actually are going to be incredibly difficult to try and achieve, then you've got to question, actually, is that going to be realised? Is that going to become part of your realised strategy? So we're thinking about targeting. This is what we want to think about when we're operationalising our strategy. What can we do? How can we do this? And sometimes also when you're thinking about, well, I'm only one person, how do I decide which order to do these things in? What can I concentrate on first? And it might well be that you'll have a few of these projects running at a time, because there'll be things that you've got wait periods on, for example, where you're waiting for information back from people. So it's looking at this. And I thought the Venn diagram was a nice idea here, because then if you can find things that have the biggest impact, is the most needed, and is the easiest to achieve, then that might be where you start. And then when we're thinking about the future for wellbeing, so we know that good work improves wellbeing. This is something that there's been a lot of research on this. There's journal articles being written about this that talks about good work improves wellbeing. This is something that we can see. It improves motivation, it improves people's fitness, it gives people purpose. And in fact, also good well-being improves work. So it's something that is good in every way then, really. So people whose well-being is good, there's evidence that suggests it also increases productivity, it increases innovation, it increases engagement. So this is a really good sell for trying to get your organization to really engage in well-being. There's some really nice evidence that says that actually if you provide a good, positive well-being environment for your staff to work in, you will see an increase in productivity. Some of that increase in productivity is because you're not seeing bad well-being, which is harming work. Of course, this is all the only things that you have influence over. Some people struggle with their well-being for issues that are outside of work, and you would need to think how you can best support somebody through those issues, but of course you have no influence over them. But we know bad well-being harms work. It leads to absenteeism, presenteeism, leavism, I think, is a relatively new term. So this is when people actually take their annual leave and work because they're being told they've got so much leave left and they need to take their leave and they should be taking breaks. So they take their annual leave and then actually still continue to work anyway. And this is seen more often, particularly with people working from home, because you can hide the fact that you're working when you're working at home when you shouldn't be, and you should be taking a break. So people who've got good well-being, you're seeing that really they are more likely to be in work. They are actually taking time off when they're not well, and they're also taking time off to manage their well-being. And we also know that bad work harms well-being. So this is in some ways more of our traditional safety things, so things like accidents. What about litigation? And people get disengaged. And all of this is also good for society. We'll see improvements, societal improvements with this.
So what can we do from a wellbeing perspective to ensure that going forward we are actually safe for the future going forward? And what we're trying to look at here as well is a transfer of culture. You know, it may be that wellbeing for many health and safety practitioners is new. It may be something they're not familiar, and they may not actually see or appreciate where or how wellbeing fits into the role of the health and safety practitioner. So it's about the education of that side and the transfer of the culture so that they incorporate and include wellbeing going forward as part of their role, and understanding the effect and positive effect good wellbeing has on people. In terms of horizon scanning, of course, we're always trying to anticipate, identify things that are just coming over the horizon. And a good example of that at the moment actually is COVID, as we are now. Now, whilst COVID may have appeared almost, it seemed, out of the blue and was almost just dropped upon us, we've now really been in a COVID environment for almost 2 years, maybe actually 2 years. And, you know, as we learn more about the virus and the different variants and as they emerge, you know, we're looking at how that could affect people's future well-being. How do we support people's well-being from that side? And what can we do to ensure that we're future-proofing things as we move forward? And then in terms of future skills, what we're doing here really is we're trying to develop a set of transferable skills that we can actually use, you know, not just for our own development in our careers as we move forward, but also in life in general, because, you know, we can adopt these skill sets and we can bring these into our own home lives and our family lives, and we can look into supporting family members and friends, etc., in their own well-being, and basically trying to make sure that going forward, well-being is a key part of health, safety and welfare, and that we're equipped to deliver that for the future.
Thanks, Steve. That was our last slide, and I've included a reference slide so you can see where we got those references from. And the slides will be available to people, and this is being recorded and it will be available, I think, on the IOSH YouTube channel at some point. So you will be able to view it again. I noticed there was a comment, somebody was saying they were driving. It would be something, if you wanted to have a look at the slides, it could be something that you could have a look at again. Okay, so I'm going to just have a look and see what we can see in the Q&A. So one of the first questions, and I think it's when we were looking at the first slide talking about wellbeing activities. So how do organisations measure the success of health and wellbeing activities? What data do you use to calculate this? And would this be a follow-up following each rollout of an initiative? Organisations measure health and wellbeing activities in different ways. And there's some wellbeing staff surveys that are available that people can use. So although don't be confused with the Warwick Edinburgh Wellbeing Survey, that's something that an individual that does that to find out how their own well-being is. So you can have a look, you can do wellbeing surveys within staff. Sometimes you can also get feedback from focus groups. I think surveys are brilliant. I think they're really good, but you've also got to be careful that you're not running surveys at a time when people will become over-surveyed. They'll get fed up with the amount of surveys there are, and I know there are a lot of organisations, especially in education, where we spend a lot of time surveying people and asking them questions. So this could be then. And the idea of is, would this be a follow-up role following each rollout of an initiative? Possibly. So when I introduced that IAC training I was talking about, after I've been running it for 6 months, I ran a focus group of attendees and asked them what difference did it make 6 months after they'd had their training, or a few months after, because it was the people who'd done it over the first 3 months of the training, to see how they'd made it. And I got some really positive feedback. So it means that I know that that initiative is working well and something to continue with. There was a question about how does it compare to pre-COVID levels, and I think this was to do with stress. It is higher. So the survey from, I think, 2019, so I think the 2021 stress level CIPD survey was reporting it at 89%, I think, if I'm remembering it from the slides. And I think pre-COVID levels, it was lower than that. I think it was more like 69%. So it was lower.
I can pick up one if you like,
Thank you,
Amanda.
Steve.
There's a question from Paul Slater. Thank you, Paul. He said, I'm surprised to not see the board as having a high influence, and I'm glad you've picked that up, and it's quite right, because as I said, it is quite fluid, and it can move in and out. And in the example that I was trying to give there was that whilst the board do have an influence in terms of agreeing strategy and perhaps agreeing and allocating resource to implement a strategy, in terms of actually writing the strategy, implementing the strategy, monitoring and delivering, I saw that more as more influence from the senior management team, the executive management team, and the people on the ground. So yes, the board do have an eye influence at a very high strategic level in my organisation. It could be very different in someone else's organisation. But for us, they would be key to get them on board, and they'd be keen to know what we're doing. But in terms of the writing, implementing and delivery of the strategy, that's more done down on the ground. But it varies and can be very fluid. Thank you, Paul.
Thanks, Steve. John Quinn asked a question about what about agreement through consultation? Yeah, really important. And it's when you're thinking about writing your strategy and who your stakeholders are. So you want to be consulting with them, running focus groups, having that consultation. And talking about consultation with unions as well, maybe this is what more you were referring to potentially, is that certainly something that we do a lot within our organisation. Like I said, I think it's really important to talk to the unions and have that consultation with them. And as I was saying, when I demonstrated it in my stakeholder mapping example, I didn't have them as having high influence, because it is a consultation exercise. And if the organisation, if what they're suggesting doesn't quite work for the organisation, then we will consult with them, but it might not necessarily mean that they will have that much influence that it would change the strategy. There's somebody asked about the stakeholder mapping, reference for the model. There's references on that last slide. Steve,
again, I can just clarify a question from Shane. Thank you. When we were talking, and I was talking about the board in work-based learning, is it an executive board or a governance board? So for me, Shane, they're an executive board. rather than a governance board, which is why the higher level, well, I had them lower down in terms of influence, because they would be very high at the start. But once they've, all they would be interested to know is what we're doing about it, and the results, rather than the actual governance board.
Okay, thank you. There's quite a lot of questions. Don't think I'm going to be able to answer all of them. I'm just a bit conscious about the time, so we'll see how we get on. There was a question saying mental health and wellbeing is now given a close eye during the education sector due to COVID. How best can we promote this area in our schools as private safety consultants, and what collaborations, opportunities can we get from this section as IOSH members? I mean, this is an example, you know, with the education group, and this is why we ran this seminar, this webinar, to help you to understand maybe about how you can have a wellbeing strategy and what you can do about it. And this is the sort of thing that we're doing. So we are certainly including wellbeing more as part of our things, which were perhaps 5 years ago we didn't talk so much about wellbeing, and we certainly are doing more of that now. Promoting things to your schools, again, it's about getting your SMT on site. I think that's really important to get that. There's somebody, Penny Gosling, has said in the chat under that about promote the DFE guidance, promoting and supporting mental health and wellbeing in schools and colleges. So there's lots of information out here that you can find information for. So there's some nice, good sharing of information there as well.
I think Collins asked, I'm not sure if we've said, will the slides be shared? I think I'm correct in saying they can be shared.
Yeah,
So yes.
Okay. I'm just having a look to see. Where can we find data research on the effect of wellbeing and work and vice versa? So I've put some links in on the references slide. What Works Wellbeing is one of the links in there, and actually they have an awful lot of information. So they are an organisation that's based with a number of researchers from universities, and they do an awful lot of research about the effect of wellbeing and work. So What Works Wellbeing is a really, really super resource for that. Very difficult. Amolo's asked a question about how can we make sure that head teachers who create an environment atmosphere that causes mental health issues and ignoring wellbeing issues are brought to account. Very difficult. Martin's given a good response there as well about, do risk assessments cover both emotional hazards as well as safety hazards? So this is where you might want to think about stress risk assessments. Stress risk assessments can help to play a part in this. What are the best courses for educating mid-level safety practitioners on the topic wellbeing? There are a number of courses that are commercially available. IOSH does have one. The IOSH course also covers about why an organisation should have a wellbeing strategy. So it's really important to make sure that you have a look around to see what it is. Maybe I should be plugging the IOSH one because it's part of IOSH, but I have to say the IACT one, there's lots of resources on there, and there's lots of free resources on there that people can have a look at. You can do the course. I trained to be an instructor. By the way, I don't get any money for this. I just have found it by far the most useful, beneficial thing that I've seen being proactive. It's written by an academic. This is why I like it so much potentially. Grants, funding opportunities, etc. available to kickstart a wellbeing programme. Not that I'm aware, unfortunately. There was some money available to support student wellbeing, but not that I'm aware for other things. I'm just going to check in the chat as well. That was in the Q&A. I'm just going to check to see in the chat while we've got a few minutes left. And there was one of the question about, so presumably the percentage is high amongst those who actually carry out health and wellbeing activities. I'm not sure all companies do. It was Jane Townsend. And yes, Jane, you're right, not all companies do. And that was a question asked of those people that do, how do they find it? So what I thought that was really nice evidence was suggesting actually if you do have a wellbeing program, have wellbeing activities. And a lot of you will already be doing lots of these, and it's how can you almost earmark them as wellbeing. So many people are involved in agile working, working from home, wherever you want to talk about it. Really good for people's wellbeing most of the time, especially if you can be flexible about it. That makes a difference.
I can't see anything particular.
Okay. Can leaveism be applied to any break during the day and into each night, not just into the annual leave period? Yes, I mean, the leaveism term is particularly about people who are taking annual leave and then working for it. But yeah, it can be people who are working outside their working hours. Wellbeing activities recommended for staff. Really, it depends on what you think the issues are within your organisation. One activity that has gone down really quite well with our staff during COVID, we did this online, was actually about how people can improve their resilience. And in fact, Steve's exercise that he did came from that. That's a resilience exercise about how can we help people. So we as an organisation should try to do the best we can to keep people safe, but then how can we help people to also help to manage their own well-being themselves, because it's really important. It's really, really important about well-being is that we as an organizations have an important role in this. We as individuals, we need to make sure that we are doing the things that we can do to help manage our own well-being. Okay, so I think that is up for time now, just right on the dot almost. So Steve, was there anything else you wanted to add?
No, just to say thank you very much to the attendees. Thank you for your questions. I've tried to answer as many as we could and as appropriate. And thank you for attending.
Yeah, okay, super, thank you. And I echo Steve's thanks. Thank you very much. I hope you found it useful and beneficial. Like I said, the slides will be available. And in fact, when the slides are shared, on the notes to the slides is the answers to the questions and the references of where they came from. So when you see those, you'll see them on there. So like I said, hope you all enjoyed it. And maybe we'll have some interaction with you again at some other webinars or events, etc. Thank you very much indeed.
Thank you.